This lecture, Lecture 4, Releasing the Alcoholic, applies all of the information from the previous lectures to an in-depth understanding of the progression of alcoholism and the recovery process. Now, this knowledge can be used to greatly enhance both the probability and the quality of recovery. In the process, we'll see that exactly the same enlightened view applies to other drug addictions. It's far beyond the scope of this brief lecture to also completely describe all of the more standard factors involved in effective prevention and treatment. But fortunately, the grassroots programs have proliferated, and this more general information is available locally to most communities. So viewers with a need for such information or for specific help with an intervention or treatment are urged to not try to go it alone. There are just too many complications, pitfalls, and hazards. But if you choose a program that is specifically for alcoholism and other addictions, staffed by the new professionals who are qualified and certified by special education, training, and experience, a program that insists on total abstinence from alcohol and all substitute drugs, that ushers patients into Alcoholics Anonymous or Narcotics Anonymous for long-term sobriety, maintenance, and growth, you'll be on the right track in selecting a local resource, whatever your need. Now, some years ago, we saw more pure alcoholics entering treatment and later in life, with a history of completing school, maybe having worked as an adult, possibly having started a family, before the consequences of the disease got bad enough to force them into treatment. Well, now we see more alcoholics seriously impaired at an earlier age, and they're far more often also addicted to other drugs. Other drugs covers a wide spectrum of commonly used chemicals, each with its own immediate neuropsychological effects and toxic after effects. Marijuana, cocaine, crack and freebase, other stimulants, sedative hypnotics, tranquilizers and barbiturates, heroin and other opiates, LSD and other hallucinogens, not to mention the various inhalants and designer drugs. Well, because of genetic differences, some people immediately become addicted. Moreover, there are wide differences in potency and in the contaminants in various street drug preparations, as well as extreme differences in people's tolerance. So even exploring the drugs is extremely hazardous. Now, the mixture of other drugs and alcohol makes the work of intervention and treatment harder and more complex. But the same basic principles are involved. So I'll start with the more typical alcoholic and later have some comments about the treatment of the younger polyaddicted patients. When they first come to treatment, all alcoholics have very serious life problems. No question about that. Frustration, anger, depression, guilt, alienation, defensiveness can be extreme. And it seems like these problems have always been extreme, even before they drank. Well, they weren't. Research shows that before they drank, the problems of the alcoholic were no different and no more severe than the problems of non-alcoholics. So understanding why their problems have become so severe is crucial to effective treatment and counseling. So let's see how it happened. I use this little line to indicate somebody born at this point, and they move through infancy, childhood, adolescence, on up into adulthood, and point out that from the time we're born we have emotional problems. We start out pretty inadequate. We can't even walk or talk, and much of what we can do is rather disgusting. And we wouldn't even, the infant mortality rate would be a lot higher if we didn't learn to smile fairly quickly. But we do learn to walk and talk and get around, and we have all of the equipment to experience all of the emotions right after we're born. And we do. And there are times we're going to beat up on everybody or kill everybody or hold our breath and kill ourselves or go out and eat worms or whatever. But there's somebody responding to all that, our parents or substitutes, so we develop a little lifestyle. And then we reach something called puberty, and there's no real rehearsal for that, so that's a disturbing period in life. And then it's time to leave home, and we have a dependency conflict. How could we not have one when we were programmed from birth with dominant parents and us in the dependent role? Now we're going to be independent. This is about the time people in our culture take up drinking. And there's a lot of trial and error because everybody has a little different tolerance and different experience with it. If they're not alcoholic, they can learn to drink so that alcohol doesn't really interfere too much with their lives. But the alcoholic doing exactly the same thing for exactly the same reasons is addicted. And so it's just a matter of time until the alcoholism begins to interfere with his life. So that's the main difference. Everybody has problems, and they've always had them. The unimpaired, non-alcoholic is typically on top of his problems. He's coping with them, moving on to more problems. But the alcoholic bogs down in his problems. At first, he tries to adjust his drinking to his life. Later, he has to adjust his life to his drinking because it's taking over more and more as the dominant force in his life. And so he's transformed. The word transmogrified. To be completely transformed to a sometimes humorous, always grotesque caricature of the self. And that's what's happening to him as the problems get worse and he's more and more out of harmony with other people. Lots of clashes, lots of stress in relationships, and of course the family catches the brunt of all that. And then they discover that he's not only unfit to live with when he's drunk and disorderly, he can be even more of a problem when he's not drinking. And that brings us to the withdrawal reaction. To illustrate the withdrawal reaction, and we'll use a simple diagram of this is the severity of withdrawal on this axis, and this will be a timeline, and we'll let this represent maybe 4 to 6 weeks. And when alcoholics first start drinking, many times they don't even have a hangover during that early adaptation phase, but as the addiction progresses, the drinking gets heavier, more frequent, they begin to have withdrawal reactions. But at first they subside fairly quickly, and they're not really too troublesome. But by the time patients come into treatment, there's typically a fairly severe withdrawal reaction. And I'll just get rid of these little lines because I want to put something else down there in a minute. Severe early withdrawal, but it's over, the worst of it is over in maybe 3 days or so. What we've overlooked is the fact that the body is still contaminated for a period of up to 4 to 6 weeks after the last drink. And during that time, as I described in the last lecture, the brain is in this hyperactive, irritable state. And with other drugs, you don't see the acute withdrawal. It's been reported that the mortality rate for alcohol withdrawal, unattended, is some 40 times as high as for heroin withdrawal. So typically, other drug withdrawals are not as severe at the start, but they last for a longer period of time, maybe twice as long as the alcohol withdrawal period, or even longer. And all during this period, the brain is in this irritable, hyperactive state, which is a perfect base for something called augmentation. And this is one of the most important factors in understanding the behavior of alcoholics and drug addicts. So that's what I want to describe next. The term augmentation is a neurological principle that was discovered over 100 years ago. And what it says is that whenever there's activity in the brain or spinal cord, anything coming into that system is going to be increased in its effects. And we see that every day in examples of displacement. Somebody is angry, maybe on the job or someplace, and they can't vent the anger, so they carry it home, it's bottled up, and somebody says something a little bit critical, and they kind of explode. That's an augmented response. Well, other examples. Many times, people who are addicted to coffee, when they first wake up in the morning, perfect example of augmentation. Brain is in a hyperactive, irritable state, blood sugar is low, and this is not a good time to try to settle an argument or to even bring up anything very stressful, because the stress that's already in the brain will augment or increase the effect of anything stressful, and everybody knows that and says, well, leave me alone until I've had my coffee. We have a more precise way to examine augmentation now in the laboratory. And I'll just quickly sketch in a first I'll put some numbers up here to indicate the strength of a response. And from very low to extreme reaction. And there's some equipment now that enables the researchers to, say, plant an electrode in the hypothalamus of a cat. And you pick the spot in the hypothalamus that is involved in attack behavior, and you have a lead out to this equipment that enables you to portray the brain waves in that area of the brain. And even at rest, there'll be some activity there. Now, we present a stimulus, a dog, let's say, in the environment, at a distance that normally would get about a 3 response of attack behavior from the cat. And sure enough, the cat sees dog, processes that information, and goes into this familiar posture. Well, it's responding, in other words, at a 3 level of response. And when he does that, the readout over here shows that the brain wave amplitude is increased. It's not a second response, it's the same response, only it's stronger, because the brain wave pattern is characteristic of that part of the brain rather than any stimulus that's causing it. Well, we have another way to do that now, and that is to put a second electrode into that part of the brain, and this is an input electrode. And let's say that we turn this little dial, we turn this little knob, and put in 4 units of stimulation from this source. And what we see, again, is the increased amplitude to a 4 level of response. And the cat goes into that posture. It's a little stronger than it was when we presented the dog, because now we're at a 4 level, but it's the same basic posture. And an observer would not be able to tell whether the cat was seeing the dog or whether current was coming from this source, because the behavior is exactly the same. And the brainwave pattern is exactly the same, no difference because of the difference in stimulation. The question then is, can you combine the two? And the answer is yes. While this is going on at a 4 level, we can reintroduce the dog over here. Cat sees dog at, say, a 3 level of stimulation, and will respond at a 7 level. The 4 units is there and augments the 3 units coming from the dog. And what we see here, of course, is a 7 level of brainwave activity, much stronger, and the cat is now just about straining to attack that dog. Very aroused, up at a 7 level. Now, the cat can never be aware of the source of stimulation from this equipment over here, because there are no sense organs in the brain. It will automatically, it's just the way we're constructed, and so are cats, that the whole 7 units will be directed to the external source of stimulation, as though 7 units had come in. And now we can see some other principles here. If the cat could introspect, and you asked it about its experience, you might make the comment that he seems to be a pretty hostile cat. That other cats respond at a 3 level, and he's up to a 7 level, so he's obviously, there's something wrong with him. He must be a very hostile cat. And he would have to defend his response. And so he would say something like, but you don't know that dog like I know that dog, because he has to account for the whole response over here. To put the whole blame on the personality and character of the cat, we can see, would be a very unfair thing to do. We're putting 7 units of overreaction, that strong reaction, on his character, and it really doesn't belong there. As a matter of fact, it's a perfectly normal cat with an artificial, so to speak, agitation in this part of his brain, which augments normal responses. Well, let's see that in a human being. And we'll just take quickly a diagram. To illustrate, we'll start with an early alcoholic who is drinking only on weekends, and he's married, and this will represent his wife over here. And he hasn't had a drink for several days. He seems perfectly normal, but his brain is in that protracted withdrawal state of agitation. And let's say his wife says some little critical thing like, how come you're late, or I see you didn't take the garbage out, or whatever. It's about a 2 level of provocation. But he comes back with an outburst, a 5 level of anger, accuses her of nagging and may swear at her, tell her to get off his back. Well, he felt 2 units of provocation from her, but there's obviously a +3 in here, and that's the state his brain is in. That's the augmentation. Now, her feelings are boosted to a 5 level. If she chooses to respond, it's going to be at that level of feeling. And there's a big problem with that because the 3 is a constant during this time period. And it's going to boost whatever comes in by 3. So now he's at an 8 level. And yes, there is a lot of violence in alcoholism. And the homicide and suicide rates are much higher. Now, most alcoholics and family members learn not to get into this any more than they have to. They withdraw and find strategies to avoid these open confrontations. But the feelings are there. And the hurt and the anger are elevated to these painful levels. And naturally, they get into blaming. She accuses him of being unloving and mean and unreasonable, and if you really loved me, you wouldn't act this way. He accuses her of provoking it and nagging him. In other words, they're putting the blame on the character and personality. And they're both wrong. That's what's normal about them. What's sick is the state that his brain is in, the augmentation. Now, they both started out as normal people, and they handled their life problems and stresses and strains and the give and take of early marriage about as well as anybody. Most of the time, their emotional reactions were in the lower levels of arousal, say in this 1 to 4 range. They'd be mildly angry or fearful or depressed or whatever, like everybody else, and they took that in stride. But now the augmentation elevates all of their emotions, and so the whole family is shifted upscale to this more extreme level, and as the disease progresses, it gets worse and worse. And even though they're avoiding each other or trying to work around these confrontations, the whole family is living with this elevated level of tension and stress. Now, at first, he adjusted his drinking to his family. But then, as the disease progresses, the family has to adjust to his drinking. So more and more frustration. The family expectations are not met. They're being frustrated. And the whole family is being reshaped to his sickness. The kids don't dare have their friends over. The best they could expect it would be to be embarrassed, and it could be a lot worse. So they learn not to count on him for much of anything. And there are more clashes, more anger, more hurt, more depression, and all of the emotions of the whole family are escalated to ever more painful levels. So now he's not only a problem when he's drunk and disorderly. Because of augmentation, he's unfit to live with when he's not drinking. The fact is, he's no longer himself. Dr. Jekyll has become Mr. Hyde, as in the Robert Louis Stevenson story of addiction published over 100 years ago. But now we can answer the question of why alcoholics seem to have had severe psychological problems even before they started drinking, whereas research shows that they really didn't. Because the alcoholic's whole brain is in the inflamed, irritable state of this protracted withdrawal period, everything in the brain is augmented, including all remembered emotional experiences before he ever started drinking. So it'll seem like his severe psychological problems predated his drinking, and that they may have contributed to his becoming alcoholic in the first place. It's also clear now why traditional counseling of alcoholics is so harmful. The brain syndrome of alcoholism creates extreme psychological problems and distortions in otherwise normal people. Then these distortions are unwittingly treated as though they are inherent features of the patient's personality and character. The same mistake that the couple were doing earlier, that I described earlier. There's the very real danger with this kind of counseling that the distorted, grotesque image of the self will be reinforced and locked into the patient's psyche as a permanent self-concept. This is iatrogenic therapy. Iatrogenic means physician-induced or therapist-induced disease. The therapist has converted a reversible brain disorder with an overlay of augmented frustration, anger, fear, guilt, depression, and so forth into a permanent psychiatric self-image problem. Well, this is the same mistake that's the source of the age-old stigma and shame, the condemnation of the alcoholic in society. With no real knowledge of the addiction and augmentation, society has always blamed and condemned the person of the alcoholic rather than the disease that has transformed him into such an insane, despicable caricature of his real self. The word alcoholic has not been a diagnosis, it's been a sanctioned form of character assassination. And it's no wonder that alcoholics go to such extremes of denial and defensiveness to avoid this dreaded label, this badge of ultimate shame and disgrace. Well, under the circumstances, if he does stop drinking, he'll have an extremely poor quality of sobriety, even after the augmentation subsides to zero, because he has to live with this really rotten, depressing self-image, blaming himself instead of the disease of alcoholism, which he knows nothing about. He naturally feels a lot of shame and guilt and depression. Trying to forgive the alcoholic or telling him to forgive himself is the ultimate insult, because it only reinforces the original mistaken identity. You can't be forgiven unless you're first guilty. Well, the blame doesn't really belong to him. It belongs to the addiction and augmentation that have transformed him into Mr. Hyde, the miserable wretch that finally comes to treatment. Then how do you treat the alcoholic? Well, first you bring the addiction and augmentation under control. You re-educate him, liberate him from the tyranny of ignorance, so he can finally know what the real problem is and how to recover from it. And then you don't forgive him, which indicates he needs to be reformed. You absolve him, exonerate him, so he can fully recover from his addictive disease. So let's diagram treatment. Actually, I'm going to use two diagrams. One for the more traditional alcoholic who tends to be older and more established in life before he gets into trouble, and the other for the younger polydrug addicted. So we'll start with this line to indicate anybody who's born at this point, moves through childhood, adolescence, and continues on into adulthood. And the typical alcoholic has made a normal start in these ways and takes up drinking when other people do in his teens or 20s. But it doesn't interfere with his life. He's able to, in fact, get the energy and stimulation and to identify very strongly as a normal human being, a normal adult, with a family maybe and job and so forth. But the addiction is beginning to become more and more a problem in his life. The public doesn't see that, but his family does, more and more preoccupied, the withdrawal, the augmented emotions, and so forth. And this would be the point where the facade begins to break down, and enough that there may be an intervention, he enters treatment, and gets started in recovery. And right about the time he stops shaking and starts feeling better, he reverts to his life of denial, that things weren't really that bad, and the counselor's job is to head that off. He's about to make his little escape into health and confront him with what's really been going on in his life. Get him off all alcohol and substitute drugs, on good nutrition. And I want to expand on that a little bit. Years ago, we used to do a lot more work than we do now. We used to do a lot of lab workups and hair analysis and injectable vitamins. And we discovered that we were getting 95% of the value of nutritional therapy with 5% of the work, and doing the other 95% of the work to get the 5% of the benefit. So we simplified everything. A balanced diet, plenty of carbohydrates, but in the form of fruits and vegetables. Get rid of all the refined sugars, the sweets, and caffeine, and some simple supplements, oral tablets that you might buy in a drugstore or a health food store, a multiple vitamin tablet, some extra vitamin C, B complex, some calcium, magnesium, and that's about it. And as I say, you'll get about 95% of the nutritional value. For one thing, your patients are extremely unstable at this point, and you're trying to hit a moving target if you try to refine the nutritional materials. Well, what about all those strong emotions early in recovery? The anger, resentment, the guilt, and depression. Shouldn't those be dealt with early in recovery here? And the answer is no. First of all, they're all augmented, inflamed. The molehills have become mountains, and maybe they've been that way for years. In convalescence, they're going to come back down and become molehills again. And then he'll find out what his real base of emotional problems is. But meanwhile, his highest priority should be on re-education. Because once he understands that this isn't his real self, what's going to support all of the guilt and depression? He's been absolved. And it takes a while for that to sink in. This isn't easy, but the payoff is enormous. Because you really get rid of all of the stigma and shame that's been in alcoholism for centuries right at this critical point. So this isn't his real self at all. This is not, this is a counterfeit, an imposter. This is Mr. Hyde in the story of Dr. Jekyll and Mr. Hyde. So as he starts to recover and looks back at all of this, and by the way, he should look not only at the ugliness of what he did, but at what he couldn't do because he was busy being sick and drunk and crazy, the augmented feelings that have been so painful to his family and so on. So look at both of them, the acts of commission, the acts of omission. Sum the whole thing up and say, not look what I did to my life, look what alcoholism has done to me. He can't be forgiven because he's not guilty of anything. So he can be absolved, exonerated. And there's a whole world of difference in this approach. But that can happen only on one really crucial condition. That he's willing, now that he knows that he's addicted, that it's a permanent condition, that he's permanently at risk, that unprotected he's going to relapse. There's a moral imperative to do everything in his power to stay in the program of recovery. If he willfully or carelessly deviates from that program, he's going to relapse, and this time he brought it on himself. He had a choice. But there were some very important values incorporated in that facade. For example, the lengths he went to protect his image as a normal adult human being reveals a very strong identification as a normal adult human being. That's going to be a very big asset as he emerges into selfhood. Can't be this anymore, this person can't be that person anymore exactly, can't go back and be a kid again. He has to emerge in selfhood as he emerges from the illness. Now, why didn't he stop when he first saw the trouble developing? It's a fair question, and the answer is he probably did. Many alcoholics stop many times. The problem is they stop for some specific reason. A health problem, to save a job, to salvage a family, and as soon as those circumstances change, the addiction reasserts itself and he's back drinking. He has no way to know the strength of the addiction and the fact that it's a permanent condition. What he needs if he's going to really recover is a source of strength outside himself. Inside his brain, head, if you will, that's where the addiction is, and at times it's going to assert itself and take over again unless he's protected. So he needs something that is strong enough, durable enough, reliable enough to see him through the rest of his days. Now, that's not going to be a human source of strength. Individual human relationships are too unstable, changing, of only temporary value. Besides, it would be humiliating and degrading for an adult to permanently depend on another individual to try to keep him sober, which he couldn't do anyway. And relationships to purely human institutions are also too weak, unstable, too limited in their power or influence. The addiction may seem to sleep from time to time, but it is easily roused, and in good times as quickly as bad. Well, what else but a spiritual power is personal enough, strong enough, vigilant enough to protect 24 hours a day, every day? I don't know of any other. And that brings us to the Fellowship of Alcoholics Anonymous for long-term sobriety maintenance. It is a spiritual program, but there's nothing else like it anywhere. And it works. It's worldwide. There are groups in virtually every community in the country, and patients are introduced to this program early in treatment so they can be familiar with it and understand how to work the program. What about the searching and fearless moral inventory of AA? Well, that can be a critical, pivotal issue in recovery also. Obviously, this is not the basis for a moral inventory. This isn't even the real self. It's that grotesque, distorted caricature of the real person. And this is a reaction to that, the facade of well-being. There are some elements of the real person here, but they're also contaminated. So the inventory has to wait until the real person emerges in recovery. He returns to sanity and goes through a brief crisis of identity until he figures this all out, and then the counselor is kind of a midwife in the rebirthing of self. And at that point, he can begin to take an inventory. And two high priority items on that inventory. One is he doing everything in his power to work the program that will protect him from relapse? And the second big priority is to get rid of the garbage, the carryover of maybe 5, 10, 20 years of living sick, to be sure that the resentments and the depression and so on are not simply carrying over and contaminating his sobriety. And that'll keep him plenty busy with an inventory until he establishes a new life in sobriety. Now, when you see lingering symptoms, let's say a couple years out into sobriety and the person is still complaining of depression and agitation and anguish and so on, there's almost always a history of one of two things. If the depression is cyclic, if it's variable, sometimes mistaken for manic depressive disorder, it's almost always due to nutritional problems. And the leading culprits are he's eating sweets, he quit drinking the alcohol, getting all those calories, now he's going for the sweets, and drinking coffee, which also triggers the release of sugar from the liver. If it's a steady, flat state of depression, it's almost always an iatrogenic depression. He got locked into this truly depressing picture of himself, and he's still struggling with it out here. Now, if all goes well, and he is making the trip of recovery, families need to join him in this. They've lived with this sickness too, and they have to get reoriented to this whole thing too, so that they can look at the drunkalogue and what they experienced in the sickness of alcoholism, and look at the alcoholic and say, look what alcoholism has done to us. And stop saying, look what you have done to us. There's a whole world of difference in that. They can come together and join the alcoholic in a new life of recovery. Now, let's get to those younger polydrug addicts, and we'll use a different diagram for that. Start them out the same kind of a lifeline from infancy, childhood, adolescence, and the difference is that many of them, if not most, have never really gotten a stable adult identity started before drugs and or alcohol take them out. Now, they'll have the delusion of control. They've only lived one life, and they lived it in this drunkalogue, if you will, or this drug state, and they'll use the same familiar alibis, denial that the alcoholic has always used. I'm not addicted. I just like it. I can take it or leave it. I prefer to take it when it's convenient, and then later they take it when it's not convenient, and finally take it when it's destroying them because they're truly addicted. I don't come down too hard on the kids for that because our whole society has seduced them into it with the propaganda about recreational use of drugs. The denial of the addiction by society, using the term drug abuse, which implies that the person was in control and they can choose not to do this anymore when they're ready, and so forth. So it's only the greater ignorance of society that makes their ignorance, their street language, their street knowledge seem like true knowledge. And in fact, they're pathetically ignorant of what's happening to them. So what about treatment? Well, you get them into a treatment program, off drugs and alcohol, and get them started in recovery, and now you got a real big problem. They have an identity crisis. They can't continue to live this life. They've been part of a cult of support, and you might well call it a cult, the funny hairdos and funny clothes and so on that identify them as members of this group. The problem is that the higher power is the addiction, and it's taking all of them right down the toilet. And if they get glimpses of that, there's always a remedy, some more drugs or some alcohol, and the fact is that drugs like marijuana blunt the ability to care about such things anyways, and so they're lost in this wilderness of drugs. Their street savvy tells them that they're in control, but they really aren't, and they'll learn that if they try to recover. But they can't live that life anymore unless they continue to take the drugs. That's the only way they can be that confused and stupid and destructive. You can't be that way unless your brain is in this cycle of drug use, or drug addiction, I should say. So they have a crisis of identity. Can't be that anymore, haven't really become what they're going to become. They haven't got any normal self-image of an adult yet, and so they have all that to create. In other words, they don't need to be rehabilitated, they have to be primarily habilitated. Many of them are barely toilet trained and housebroken when they fall into this trap of addiction. And starting out isn't easy. But it is possible, and in fact, it's going to look a lot easier if they have the guts and patience to endure a little longer. And I find it very helpful in counseling to use this, to refer back to augmentation. That yes, you are alienated from parents, you have strong feelings about normal society and so on, and remember that those are all augmented, that they're inflamed. As the healing takes place, the augmentation subsides, and then you find that you can handle the 2 units of stress in your life, the 5 subsides to 2, and life is really pretty manageable. But also, your perspective, as you get through that period of recovery and look back, you discover that your earlier life was not completely wasted or frustrating, that there were some good things back here too, that you really did learn a lot of things that you can put to good use in your recovery. Now, I personally favor mixing the younger patients with the older, more traditional alcoholics, because it provides these kids with role models, people who have been through a similar disease, the same disease really, but who have a kind of a head start on recovery. And these younger people can, through identification, use those role models to good advantage. if they're willing to make a total commitment to the recovery process, they'll soon discover that it's not only possible, but that it's far more rewarding than anything they've done in this other life of theirs. And many of them can and do. With that total commitment to recovery, they will recover. And then they too can be absolved, because they really were had too. The ignorance that they grew up with, ignorance of addiction, they were seduced into it, trapped in it, and the rest sort of unfolded, and they have a right to walk free and clear of that life of addiction. Many of them do. So to summarize, get the addict off alcohol and all substitute drugs, on good nutrition, allow time for the wisdom of the body to do the healing, release him from the counterfeit self of the addiction into true selfhood, usher him into the powerful growth program of Alcoholics Anonymous or Narcotics Anonymous, and he can expect to enjoy a lasting sobriety and full recovery. Now, as I indicated at the beginning of these lectures, my purpose has not been to present all knowledge of alcoholism, but to present enough basic strategic knowledge to dispose of the false beliefs and misinformation, and to establish premises on which all of the other factual knowledge can come together freely in its own natural pattern. Well, in these brief lectures, I have therefore assembled only the skeleton of the picture, leaving considerable work to the viewer to fit the other pieces into place. This task will be easiest, I'm sure, for recovered alcoholics and for those who have been privileged to work closely with alcoholics, witnessing their marvelous transformation in full recovery. For others, it may take longer. But even this brief outline can provide a new plateau of understanding, above the fog of confusion that has paralyzed society for so long. To release the addict from his grotesque self-image is at the same time to release him from the stigma and the shame and the condemnation of society. So these lectures are for everyone, because everyone is touched by the disaster of addiction and has a need to know the truth. Thank you very much for your interest and attention.